the American Academy of Pediatrics is strongly advocating that students be physically present in school as much as possible. The Medical Association cited documented evidence of the benefits of in-person learning, as well as the negative impacts that physicians say they've seen as a result of early school closures.
What I've noticed over the past number of months is there has been a tremendous rise in the amount of mental health concerns. Many children feel isolated. The rise of depression and anxiety because of their absence from school and isolation at home have gone up tremendously. The more that we see in terms of mental health problems in children, it increases the risk for potential mental health complications, including suicide.
The AAP says in-person learning also helps children who have learning deficits, are at risk of abuse, or don't have access to healthy meals. The association also cited mounting evidence that shows COVID-19 appears to behave differently and is transmitted less frequently in children and adolescents than other common respiratory viruses, such as the flu.
But we do need to obviously mitigate the risk of COVID at the same time.
Sandy Chung is president of the Virginia chapter of the American Academy of Pediatrics. She says school policies need to be flexible in responding to new COVID cases.
We know that some of the strategies that help to mitigate risk include social distancing, making sure that children are wearing masks as possible, certainly that the adults are wearing masks that are at the school. These are all important to do. And really the only way to do this in the fixed space of a classroom is to reduce the number of children in a classroom at a particular time.
We, of course, need to do some more thinking and some more detailed work on this.
Monday night, Richmond School Board members reviewed the results of a recent survey that indicates most families and staff prefer an alternating 2-day schedule for students in the fall, with a 5-day-a-week opportunity for students with unique needs. Physicians say whatever plan schools choose, families must weigh the benefits and risk.
It's really important that you think about your own family's risks, but also your own child's needs and whether or not your child would do better in a school environment rather than being at home in front of a computer.
Now, the Richmond School Board plans to vote on a reopening plan on July 9th. Meanwhile, the Chesterfield County School Board will host a series of virtual community meetings starting tomorrow at 9 a.m. Zach?